The health and social care sector in northwest London is currently undertaking an ambitious project. The overarching objective is to deliver a new commissioning framework for an integrated care system to best serve 2 million people in a cost-effective and patient-focused way. Imperial College Health Partners has been exploring examples of international best practice to help health and social care leaders with the design and implementation of this significant change.
One good example of best practice originated here on the east coast of Spain. It's been titled the Alzira model. This model highlights a successful integrated care system that's overcome many challenges and problems since its creation. In this short film, we'll seek to understand more about the Alzira model and its key learnings to help inform thinking and development around the whole systems integration programme in northwest London. The Alzira model, which operates as part of the Ribera Salud Group, was born in 1999 in Valencia, when the first privately managed public hospital in Spain, the Ribera Hospital, was established. The creation of this hospital was based on 4 fundamental pillars: public ownership, public control, public financing, private management. While northwest London isn't necessarily looking to move to privately managed services, there are many learnings that can be taken from what's been built here in Spain.
Since 1999, the Alzira model has grown into a fully integrated healthcare delivery system, bringing together primary, secondary and specialist services across 5 towns here in the Valencia region. The model's been so successful that it's extended to the country's capital, Madrid, as well as transcending the Spanish border into Portugal.
Today we're visiting 2 districts in the Valencia region where the Alzira model is operating, here in Torrevieja and in Elche Vinalopó, together with a combined population of 300,000. Serving them are just over 2,500 healthcare professionals and admin staff, 50% of whom are nurses. Specialists work across secondary and primary care settings, acting as what the Alzira model referred to as counsellors.
And importantly, primary care professionals have been given the means and tools needed to perform to a consistently high standard. Historically, this hasn't been the case. This approach, together with integrated information systems and integrated clinical processes, result in a service that is seamless for the patient and centred around their needs.
The main difference is how we organize the primary care, and the day-to-day job is exactly the same. Here at this medical center, for instance, we have the minor surgery unit. We are the referral center for minor procedures. Patients don't need to go to hospital, they come in here, and we have a computer system that make us to be in constant contact with them. We know where our patients have been, if they have been admitted to a medical unit, if they are in an emergency department. We are in real time. We know what the doctors at the hospital, how they're treating the patient.
And as all professionals and disciplines are part of the same organisation, there's an evolving culture of cohesiveness and collaboration, which really comes across strongly when talking to the clinicians working in these centres.
Es importante este sistema de incentivación porque el propio profesional ve recompensado su esfuerzo y su trabajo diario. El que más trabaja y el que más aporta, el que más implicado está, es el que más recibe.
The Alzira model is based on capitated funding, which means that the organisation is paid a fixed amount each year to provide care for an agreed population. For the 2 districts we're visiting today, the organisation receives €639 per head of population. That's to provide all levels of their care, from GP consultations to specialist services. Whilst this model of funding transfers all risk to the provider, it helpfully eradicates perverse incentives that can emerge with other funding models, encouraging collaboration, efficiency, and ultimately high-quality services.
Money follows the citizen, so for us it's critical to promote health. The healthier the citizens are, the better for everyone, for us and for the system itself.
The districts served by the Alzira model are really seeing the benefits. For example, improved patient outcomes and experiences, which we'll look at in a moment, but also increased efficiency savings of up to 35% compared to the districts in the Valencia region that aren't using a capitated funding model. Clearly, the transition to an integrated care model is very challenging, not least of all because of the sheer scale of change that has to be undertaken to achieve success. In a few moments, we'll speak to some of the people behind the Alzira model about its implementation and some of those challenges. But first, let's take a look at the results it's been producing.
As we can see, the Alzira model outperforms other local healthcare providers in areas such as average length of stay, emergency admission rates, readmission within 3 days, and patient satisfaction.
So, to explore the model in more detail, let's see what some key members of staff have to say.
The biggest challenge that we faced was cultural change, and I think that it will continue to be cultural change. It's always about people, after all.
Uno, el cambio de estructura. El otro, el cambio de mentalidad. Y, además, esos dos cambios deben de realizarse al unísono, a la vez.
Well, we overcome that cultural challenge by defining a clear strategic plan and sharing it with our professionals and getting our professionals involved in the process. We capitalize on integrated healthcare because it makes no sense to us distinguishing between primary or hospital level. The patient is the same, the citizen is the same, the system itself is just one. So we put all our professionals working together.
Bueno, nos basamos primero en una buena selección del personal, que ese personal apoyara y conociera perfectamente lo que queríamos hacer. En segundo lugar, una comunicación muy importante, tanto dirigida al personal como a la población, que la población supiera también lo que queríamos. Y en tercer lugar, tenacidad. Problemas va a haber siempre muchos. Tendremos que ser persistentes, tenaces en conseguir lo que nos hemos propuesto.
The Alzira model has generated a fundamental change in healthcare delivery in Spain. This has resulted in improved patient experience, improved patient outcomes, improved staff satisfaction, and improved efficiency savings. However, the success of this model didn't come without its challenges. So we've learnt about some of the barriers and obstacles that the Alzira model came up against. These ranged from cultural issues such as resistance from clinical professions to the technical challenges like integrating information systems. Delivering sustainable change clearly requires a roadmap owned by engaged and committed professionals at every level. And ultimately, these professionals need to be given the tools required to make that change happen.